Hi there, my name is Ryan Miller. I'm a clinical psychologist with the U.S. Department of Veterans Affairs, and I was the Behavioral Medicine Fellow in 2010 and 11. It's a privilege to be able to speak to you today about the fellowship training. I'd like to talk for a couple of minutes about my training and my experiences since graduation. One of the things that I always think back about my time with the fellowship training is that this really set me up for success in ways that I have been able to appreciate every week now in my clinical um, course of duties at the VA. I think this prepared me for practice in ways that I never even anticipated. I think the knowledge base that I acquired, I was going back and forth between Bethesda and Smiley's clinic, and the knowledge base acquired there really continues on for me week to week, and it's really brought me to a point of excellence in my career, and I think that that's really unique. I have the highest award for my work in primary care in the entire VA system. I have the Cabinet Secretary's Award um, for my work in primary care, and that's a direct result of my training with the U of M. I'm also up for for consideration for the Minnesota Hospital Association Annual Award. Um, and again, this is because of the training that I received from the U of M. Being a part of the residency program and a multidisciplinary treatment team, clinical pharmacy, the physicians, this knowledge base really has paid off for me over the course of the years to the degree that I don't think anything else could have prepared me for practice as well as it did. The thing I appreciated most about the program was being in two locations and being a part of a multidisciplinary team in two different cities, two different clinics, and the different exposure I had to the two different residency programs. It was very unique. I thought just being a part of the residency program for 2 years is unlike anything that my peers have ever experienced. And it made me appreciate residency training and what my colleagues go through in terms of their training, and it helps me to understand their practice. That's also very unique. One of the strengths about the program that I can say for sure, in addition to all that, is that I've had diversity experience in the fellowship, unlike anything I'd had previously or ever since. Ethnicity, culture was one of the most unique experiences I could think of, and I know that over time this has made me a better practitioner. It's also influenced my teaching. I train interns on rotation with me at the VA. And the training from the U of M has helped inform my teaching and my practice. One of the things that's, again, another unique perspective for the program is I think about the length. I've met a lot of one-year postdoc trained colleagues, but I think fellowship training is very unique, and I think the sheer fact that it's 2 years makes you. I always thought that I could handle anything that walked in the door, and that's really true. I think the first year for me was establishing competence, and the second year was achieving excellence, and that's really the uniqueness of the 2-year training. I think the last thing I would say about living here and practicing here is that I felt at home in both locations, unlike probably anywhere I had worked or trained before. It was absolutely amazing being in the clinics. I felt very accepted. It was very welcoming. It was a privilege to be in both places, and it really felt like home. And I think that it was very wonderful, not only being in the clinics, but also in the Twin Cities and in Minnesota. It was an excellent experience. So if you do apply, or if you're applying now, I wish you the best, and I can't say enough great things about my training. Thank you very much.